Hi everyone, my name is Sharon Su and I'm a second year dental student. The study that I will be presenting today is titled Impact of the COVID-19 Pandemic on Dental Education, which was recently published this past September. Starting off with some background, COVID-19 has affected all parts of our lives. Particularly for schools, it has caused closed campuses, postponed lectures, events, etc., and has caused schools to transition to online learning. For dental clinics, COVID-19 is known to spread via respiratory droplet or contact and is abundant in nasopharyngeal and salivary secretions. Thus, dental offices face increased risk for contraction. The CDC recommended only essential dental care to preserve PPE for frontline providers. For dental education, COVID-19 has disrupted clinical and simulation experiences. Dental education includes all levels of risk defined by the CDC, which includes low risk, as in virtual classes, more risk with in-person classes with individuals 6 feet apart without shared materials, and also high risk, where individuals are not spread apart and materials are shared. The COVID-19 pandemic arguably represents the worst public health crisis of the 21st century. However, no empirical study has currently existed in literature to examine the impact of COVID-19 pandemic on dental education at the time that this study was started. This study evaluated the impact of COVID-19 on dental education and dental students' experiences. The objectives of this study were to evaluate the impact of COVID-19 on dental education and to explore students' views related to school closure and educational experiences, as well as the impact on their physical, mental, social, and financial health. Our methods consisted of an online anonymous survey administered to professional dental students at Roseman University that focused on their experiences related to COVID-19. The survey consisted of demographic questions and 38 items related to school closure, educational experience, physical, mental, and financial health. Survey items focused on 6 general domains, which included protocol considerations after reopening the school, institutional responses, student academic concerns, student physical health concerns, mental health concerns, and financial health concerns. Descriptive statistics were used to explore the distribution of the item responses. Independent samples t-tests were used for continuous variables. Z-tests and chi-square tests were used for group differences between proportions, and Spearman correlations were used to describe the relationship between age, impact of school closure, and concern related to COVID-19, all with a statistical significance level set at p-value less than 0.102 cited. The following are the results of our study. In terms of demographics, among the 145 respondents, 92.4% were pre-doctoral dental students, with 7.6% as orthodontic residents. 48.2% were female, and 66.2% were Caucasian, with 6.5% as Hispanic or Latino. The average age was 28 years old. These are the results in terms of their academic concerns. With regards to transition to online learning, 87.6% of students reported a high degree of comfort adapting to technology. 38% were concerned about the quality of their online courses, and over 40% often or always found it difficult to focus on schoolwork and experienced difficulty finding motivation to study. In terms of graduation and exams, 42.8% of students expressed concern about the likelihood that they would be able to complete their degree on time. 46.2% were concerned about passing their dental boards in a timely manner. And most students expressed reluctance about making up lost educational time and experiences. Here are the results for the institutional response. In general, students felt that their clinical education suffered after transitioning to online, but responded more positively about adjustments to other online curricular components. Overall, students rated the school's response as somewhat or extremely effective, felt positively about transitioning to remote online classes, and thought that their professors were effective in teaching online classes. However, students were far less positive about their clinical training, with only 27.1% of students reporting their professors as being effective in providing clinical experiences during school closure. With regards to their physical and mental health, 40.2% of students were concerned about their physical health. In terms of contracting COVID-19, 20.8% often or always felt anxious that they might be infected. 69.5% were concerned about contracting it from providing patient care in clinic, 64.9% about contracting it from attending classes in school, and 66.9% about contracting it from interacting with people in the school buildings. With regards to mental health, 32% were concerned about their emotional health, and younger students tended to express more concerns. 8.3% often or always felt depressed. 21.4% expressed concern about not being able to secure housing after they returned to school from the pandemic shutdown. 80% had concern about the well-being of their family, and 40.7% were concerned about being able to keep up with their social connections. In terms of their financial concerns, nearly half of the students, or 49%, expressed concern about their financial stability. 22.2% often or always reported anxiety that they will have difficulty finding a job after graduation. And over 1/4 of the students were often or always anxious that they will be unable to make ends meet in the next few months. When asked about protocol considerations, 62.3% believed that everyone should wear masks always or often while at school. 20.3% believed that everyone should always wear gloves in school. And almost 83% believe that social distance practices minimizes the development of COVID-19. In terms of COVID testing, 23.1% opted for daily COVID-19 testing, while 38.5% favored weekly testing. When correlations between age, impact of school closure, and student concerns related to COVID-19 were examined, here are the results. Younger students had significantly more emotional health concerns. Students reporting a greater negative impact of school closure were more likely to report emotional health concerns, convey more social connection concerns, and express greater concern about contracting COVID-19 while attending classes and moving around in school buildings. Students most affected by the closure found it more difficult to find motivation to study. Our results show that students worried about their financial situation. Over 50% expressed doubt about meeting financial obligations, and 48% reported by Active Minds expressed troubles about financial setbacks. Students were also anxious about finding jobs after graduation. Unemployment is the highest since the Depression era, and COVID-19 could worsen the job market. The dental profession also has one of the highest health profession debt-to-income ratio. Thus, students were worried about their looming debt and unemployment. Students were also concerned with their mental and physical health. Low social connection and high stress is associated with worse health problems, and a loss of supportive network may push those at risk for poor behaviors into riskier situations. Thus, we must augment existing counseling and behavioral support and communicate plans and involve students in decisions. Additionally, most students were worried about the well-being of their family and contracting COVID-19 at school. The ADA and CDC provided guidance for dentistry, including PPE, screening patients, sanitation, and distancing. And our results show that students favor these guidelines. Additionally, a lot of students express stress related to the pandemic. Evidence that stress results in poorer performance, lower physical and emotional health, and higher emotional exhaustion exists in published literature. The current pandemic exacerbates and adds to these problems. And so this is an opportunity for administration to consider safe and effective environments for all circumstances. And finally, one of the students' greatest concerns was their clinical care education. Most positively favored online curriculum, and despite concern for clinical training, only a small portion favored adding time to make up for lost clinical time. Thus, administration should consider other strategies such as simulations, demonstrations, and teledentistry. Our study has some limitations, including that it had only examined one dental school, and that the pandemic continues to evolve, so recommendations and guidelines are likely to change. In conclusion, the COVID-19 pandemic significantly impacted dental education. Students are experiencing increased levels of stress and feel that their clinical education has suffered. Most students are comfortable with technology adaptations for didactic curriculum, and most favor masks, social distancing, and the liberal use of sanitizers. Our study can provide insights to inform decisions not only for dental schools, but also for all health professional schools and the public. Thank you.